Good afternoon, and thank you for joining us for this community briefing. Joining me today is interpreter Sharon Sinkler, and thank you so much for your services. We are here today to inform our community of some breaking and heartbreaking news related to COVID-19. The Lincoln Lancaster County Health Department has confirmed 3 more deaths today from COVID-19. Over the last 3 days, we have lost 6 members of our community to this virus. The total number of COVID-19 deaths in our community is now 30. This represents a 25% increase since Sunday in the total number of people who have died from COVID-19 right here in Lincoln and Lancaster County. Each one of these individuals was an important member of our community, and we express our condolences to their friends, family, and loved ones. In just a few moments, we will hear more from Director Lopez and leaders from Bryan Health and CHI St. Elizabeth. Before we do, I urge everyone in our community to stay smart, to stay safe. Stay smart to save lives. Stay smart to keep our businesses and schools open. What does staying smart look like? It looks like each of us taking care of each other by wearing our masks, washing our hands, and watching our distance from others. In the face of understandable COVID fatigue, I am asking everyone in Lincoln to rededicate themselves to these proven strategies to protect our friends, family, and neighbors, that support our businesses and our economies and our city's economic recovery, that allow our students to stay in the classroom, and that ensure that our healthcare system can meet our community's needs. We have enormous collective power in the face of this pandemic. Let's use that power for the good of all Lincoln. The choices we make matter. They matter to lives and livelihoods. Health Director Pat Lopez will now give us an update on the latest situation.
Thank you, Mayor. The 3 COVID-19 deaths that we are reporting today are all men. One in his 70s who was hospitalized, one in his 60s who was at a long-term care facility, and one in his 50s who was hospitalized with no pre-existing health conditions. As we have learned, children and young adults usually do not develop severe disease, while older adults often do. However, hospitalizations and deaths do occur in all age groups. So far in Lancaster County, we have lost 13 people between the ages of 40 and 69. Some of these deaths have been otherwise healthy individuals who do not have underlying medical conditions. As COVID-19 deaths, a COVID-19 death reported earlier this week was a 46-year-old male who also had no pre-existing health conditions. Today in Lincoln and Lancaster County, an additional 71 individuals have tested positive for COVID-19. The total number of lab-confirmed cases is now 7,075. We are seeing more cases in people over the age of 30 than we have seen any time during this pandemic. In 3 of the last 4 weeks, there have been at least 90 new cases in between the ages of 30 and 39. In the 40 to 59 age group, we have seen over 450 new cases in just the last 4 weeks. Over the past 5 months, we have seen an average of about 14 cases a week in the 60 to 79 age group. However, in the last 3 weeks, the average number of new weekly cases in that age group has jumped to 62. We have also seen 35 new cases in individuals aged 80 and over in the past 3 weeks alone. This virus is now widespread in our community. As a result, we are now seeing an increase in local hospitalizations. Today, 63 patients are hospitalized, and 11 are on ventilators. 36 are Lancaster County residents, and 27 are from other communities. We are concerned that the number of COVID-19 hospitalizations will remain high, especially when the flu season ramps up in a few weeks. This would have an impact not just on hospital capacity, but also on healthcare staffing if many of our hospital workers become sick and unable to work. The best way we can avoid that situation is to take a twofold approach. Continue to take the common sense precautions to prevent the spread of COVID-19 and get a flu shot before Halloween. The health department has continued to work closely with our hospitals, and that partnership has been a key part of our strategy. With us today to speak are Tim Plant, the chief nurse at CHI Health St. Elizabeth, and John Woodrich, the president and CEO of Bryan Health. And welcome Tim to share some information.
Thank you, Pat, and thank you for the opportunity to be here and share some information. So at CHI Health Elizabeth, our capacity right now is about 30% of our critical care beds. As of today, we have 16 positive COVID patients that are acutely ill and 5 ventilators in use. We are lucky to be part of a larger healthcare system where we can share supplies, we can lend supplies, and we can also receive supplies if we need it. And that's exactly what we did when the surge first happened back in March, April, and May. We have a better understanding of how to care for COVID patients, and our physicians and nurses are well-trained and ready. St. Elizabeth also serves as a hospital and a quarantine center for the state of Nebraska. We've been receiving patients over the past 6 to 7 months on a daily basis. So we do take care of COVID patients, and we know how to do that. We can help our system hospitals and other hospitals across the state in the event of a surge. CHI Health also operates a state transfer center and helps distribute patients throughout the state in the case of a surge to make sure that they get to the best level of care for their current conditions. We, of course, are monitoring our PPE and equipment, just as we've been doing each day throughout this pandemic. And no matter where anybody chooses to access care, especially within our system, we can guarantee that no one will go without a bed. We are tight with capacity across our system right now, but it's important to note that we are also caring for patients with other illnesses and not just COVID-19. Our advice is that it's not a time to panic, but it's a time to stay very vigilant and keep an eye on the course of this pandemic. You can do your part by wearing a mask, keeping a social distance from others, and washing your hands frequently. Are we worried about the flu? Well, yes, we're worried about the flu every year, but it's no more than in years past. It is complicated by being in the middle of a pandemic, and so I would recommend that everybody get a shot and then practice the socially distancing. Thank you.
Good afternoon. I'm John Woodrich from Bryan Health. I wanted to share with you about some of our capacity. We run about 85 to 95% capacity depending upon the day. There are days that will peak to being full, but that is kind of the tradition we see at Bryan. What we've done in the last several months is opened up new units to help with the influx of COVID patients. We do have a commitment that we will not turn down a patient. We have accepted any COVID patient throughout all of Nebraska. Our tradition is that we support our entire state. So we will continue to flux as we need to and open additional units. We also have the capability to, for some of our electives, not just elective surgeries, but elective procedures, to fluctuate those if our need is there for additional COVID patients. So assure this community that we will continue to serve this community in this region to the best of our abilities. I'll be honest with you, our staff have been dealing with this pandemic for now 7 months plus. They are tired. We have brought in additional support for them. We continue to bring in agency staff, but they're very committed and we're very proud of these people. And I know CHI would say the same thing. These healthcare workers are quite amazing individuals. I do want you to know that we do have the capability, should the surge continue to increase, as we convert rooms, we do have a plan with even other facilities that maybe they could take patients that are a less acuity, not a COVID patient, so that we could continue to handle any major surge. But the best way to control that, you've heard. You know, we let our guards down. I think everybody wants this to be over, but we have to continue to wear these masks. We are going to have to continue to social distance, avoid these large gatherings, continuing to wash your hands. But I think one of the best things we can do is point it out to our friends as well, because you're going to watch them let their guard down. It's the best thing we can do to continue to control this. I do want to assure you that all of the healthcare facilities in this region are working together. We're working with our health departments. We're working with our government officials. You know, I think all of us were really caught off guard at the very beginning of this, but as people have pulled together and brought resources together and brought the best of the technology and abilities that we can do, I'm very proud of them. I think they're in a very tough situation as government officials because everybody's giving opinions of what to do. But I believe we've got to keep our schools open. We've got to be able to keep this economy open. So many individuals' jobs are being affected, but they're also doing it at the same time at looking at the safety of this community. So I know safety is number one, and it's a tough balance to continue to do, but we're here working together to help support this community. Thank you very much.
Thank you, Mr. Woodrich and Mr. Plant and Director Lopez for being here today and for your leadership and for the way you've continued to work together throughout this pandemic to protect our community. Part of the way we seek to protect one another during the pandemic is to understand our specific vulnerabilities. And what the health department case investigations show is that many who have become positive for COVID-19 have attended family gatherings or gone to a party or hung out with their regular circle of friends, but without masks or physical distancing. This creates perfect conditions for COVID-19 transmission. It's like opening the door to the virus and inviting it to join the party, which the virus is happy to do. These smaller gatherings and get-togethers with no precautions in place are contributing to precautions in place that allow us that we reduce the risk of spread when we take these common sense precautions. Continue to stay smart to save lives. With that, I'd open it up for questions from the media.
Mayor Riley with the Journal-Star with questions for Director Lopez.
Be right up. Thanks.
Hi, Riley.
Hi, Pat. First question, were any of the deaths reported this week tied to the outbreak at the Lincoln Eagles Club?
You know, what I would tell you to do is maybe just get the obituaries. I haven't been officially notified of that, but I believe in the obituaries. An individual was listed as the secretary for the Eagles Club.
Another question, is there any clusters emerging in a long-term care facility? I know you mentioned one of the deaths was being treated in a long-term care facility.
Yeah, and I think that individual had been hospitalized just prior and then back, but we don't have any current outbreaks in a long-term care facility. There are other surrounding areas. We do have people that have gone in and been hospitalized that are COVID positive from long-term care facilities. But as far as a larger outbreak in our community, we do not have one.
Last question, and then I'll turn my mic off. Obviously, 3 deaths concerning, especially coming this week with a couple more, but what is your sense for the mortality rate here in Lancaster County and compared to, you know, the national and state rates, and what affects that, do you think?
You know, Riley, I can't give a percentage. That's one thing I didn't really think about this afternoon, but I think if you look at our deaths and you look across even just our state, our numbers are very, very low in our community. We're much smaller than even Grand Island or some other areas. And I attribute that to the fact that we have partnered from the very beginning with our healthcare systems, with our physicians, with aging and all others to put in precautions in place. And most of all, I attribute it to our community listening and trying very hard to maintain the practices that we're asking them to do, those common sense approaches. It has really made a tremendous difference. And we actually did proactive prevention measures, both in our long-term care facilities and out into the community right away to protect our community. So that's made a huge difference in the number of deaths that we've had in Lancaster County.
Hi, Pat. This is Bill with 1011. There is a social media theory out there that the increase in cases, the increase in deaths is proof that a mask mandate doesn't work. I was hoping for the medical and scientific rebuttal to that.
Well, I can give you plenty of case studies. We'll be happy to send you the articles. And we do know that the mask mandate has made a tremendous difference in our community. And we also saw that with our case numbers still going down. Now that we have more widespread in the community at all, we're really benefiting from having the mask in place. I want to remind people, our schools started, our K through 12 schools started in August 12th here. We've done some balancing LPSS high school, but our schools have been open and our students are in school and our students are not showing classroom transmission.
This is Brent with Channel 8. Going off that, and this might be more for the mayor, but given the situation, are there any plans to extend or add any restrictions like the mask mandate to try and combat the growing numbers?
Right now, we currently review the directed health measure, and I think, as the mayor mentioned, I'm going to have her step forward and answer. But we've looked at everything with our case. The mayor mentioned our contact tracing that we do in those case investigations. And what we are seeing is it's these smaller things that are happening in the community gatherings where people are not wearing their masks and not physically distancing that are probably the bigger issues. We can't attribute it like we did to the Eagle situation, for example. We can't say we had a large gathering, we have all these people attending that. So we're constantly looking at if there are other measures we need to put in place, and we certainly will do that if it's going to protect the people in the community. I'll let the mayor.
Well, just to remind everyone, the transmission of the virus, we've learned, occurs through respiratory droplets that are released when people speak or they sneeze or they sing or they yell or they cheer. So if these droplets land in the mouth or nose of others nearby, or if they're inhaled into the lungs, that's how we see the transmission of COVID-19. People contract the virus that way. Masks create a physical barrier that prevents the distribution of those droplets and lessens the chance from of someone else nearby becoming infected. We've seen studies show that there is now evidence that also protect the mask wearer, that when you are wearing your mask, you're less likely, if someone sneezes in your vicinity, to receive as much of a viral load if they're transmitting COVID-19, and less viral load leads to less severe illness. And then finally, I would just add that there's even an article in the paper today where people are developing hypotheses about the extent to which the mask has, can function in lieu of a vaccine somewhat like one, that if we are experiencing and ingesting any bits of the virus, that we can start to develop some immunity to it, but that the mask allows us to limit the amount we are exposed to, and that is so good for us and it's good for the people around us. So the masks continue to be one of our number one public health strategies to protect our friends, our families, our loved ones, to help out those tired healthcare workers who are tirelessly reporting to work to tend to our illnesses and our needs, who are doing so under trying circumstances with more gear than they've ever had to wear, with more stress. They're filling the role of our family when they are supporting people who are in the hospital, who can't have family visit them because of COVID-19. We can support them and our community by wearing our masks. And we do the updates to the DHMs on a monthly basis because we acknowledge and recognize that we need to continually evaluate the latest data and information so that we are doing our best to be responsive to current conditions as we protect the public. The mask mandate is going to continue to be a part of our DHMs as long as community conditions and data demand it. It is something that we reevaluate, but we all need to acknowledge it won't be there forever. We won't always have signs on one of our businesses asking people to wear masks like we will always have them asking to wear shoes and shirts to have service. So there will be an end, but it's going to be a while, and we need to just get comfortable recognizing how much good we are doing for one another and for our community, and really for, beyond our community, our state and our country, when we wear our masks.
Still a couple days to go, of course, but how is this going to factor into the risk dial placement for this week, and how close are we getting to that red zone?
I don't have an answer for you on the risk dial today, but we will be back Friday with an evaluation because we look at 3 weeks worth of cumulative data. We want to base that decision on those full 3 weeks, and that's why we do those updates on Friday, even though it's not a great news day. Sorry about that.
Riley with the Journal Star. I have a question for either Mr. Plant or Mr. Woodrich. Has to do with ventilators.
Okay, I'll be right up.
Maybe I'll just ask it and then you gentlemen can figure out who wants to answer first. But with ventilators, are there ventilators that are set aside for flu patients who need them, or are those all dedicated to COVID, or how are they sort of allocated in care?
Thanks for the question, Riley. The ventilators are for whoever needs them. And so we do have a finite amount. At St. Elizabeth, we have 24. 5 are in use right now. And so, somebody might come in with something else, another illness where they need it. And so, we want to make sure that those are available to everyone. That being said, CHI Health, as a division across Iowa and Nebraska, we do have an extra supply, and we do share our resources as the capacity dictates.
This is Andrew Ozaki from KETV Omaha. Is there an explanation as to why we've had this spike in deaths? Is it because the virus is changing, or is it just, it's hard to explain, or is it because these particular patients got maybe a bigger dose or a bigger load, so to speak, of the virus?
I just wanted to answer that previous question from the Brian perspective about ventilators. We have a number of ventilators. We're not concerned at this stage in relationship to running out. We have the capability of converting other machines, such as anesthesia machines, into ventilators, so we feel we're in pretty good shape at this point.
Hi, Andrew. I just wanted to, speak to your question. We are seeing our highest number of cases per week, and I think we showed you the graph. So if you start looking at where the cases start, when we start seeing those, and then you follow that along, you can see where we have people who are becoming ill, and we do have people who are acutely ill in our community because we have that wider spread. So when you look at the graph, you can start seeing where at an increased number, and then you start seeing the rise go up. So as our cases go up, then you'll start seeing there'll be increased hospitalizations, which is what we anticipated all along, and is what we have been planning for and addressing. But we are at this critical juncture where, as Mr. Woodridge said, and the mayor and Mr. LaPlante, you know, it's really critical. We can do this. We can wear a mask, wash our hands, and watch our distance. That's how we're going to prevent this spread. And that includes being with our family members that aren't in our household. When we're with them, we make sure we follow these same precautions. So if you just look at the graph, you can see where that change, it follows. You know, from the time our case numbers start going up, that our hospitalizations will also go up because we have more exposed individuals. And I believe I spoke to some of the older adults we are now seeing. We've had some double digits. I reported that last Friday, and again today talking about that, and those over 65, which is not something we've seen previously. And we're seeing that with our hospitalizations and as well as the age groups that are being impacted.
Director Lopez, before you get too far from the microphone, do you know how long the people who have died from COVID-19 who were hospitalized, how long they had been in care on average? I mean, are many of them there for a week or longer, or and how does sort of their need for ventilation factor into the outcomes?
Usually 2 weeks, and there are some individuals that have been much longer, but usually 2 weeks, and especially when somebody's on a ventilator. They're hospitalized for a longer period of time, but we haven't graphed all those out, Riley, to look, but that's something we could look at again. But in general, in our communications with the hospital that we have, you know, we're meeting with our hospitals on a regular basis, at least once or twice a week. We were daily, but we've moved those meetings back up again to have conversations to stay on top of that. And I do want to point out, I think Mr. Woodridge mentioned, you know, we do have a surge plan in our community that was developed with our hospital and our providers, and we do have that readily available to us should we need it. And I think, as Mr. Woodridge pointed out, we're continuously evaluating where we're at, and we will be sharing that information with the public.
Andrew, I have another question. Do you have any breakdown on how many of the cases were spread indoors and how many cases were spread outdoors, especially as we get to colder weather?
No, I don't, Andrew. And we could probably go back and look at our case investigations based on where they were at, but that isn't something that I can readily tell you. But we are concerned with colder weather, so thank you for bringing that up about being inside. We really need to be vigilant when we're inside with others in any environment that are outside of our immediate household.
Pat Riley at the Journal-Star. Is there any update to the total number of cases tied to the Eagles Club outbreak?
No, you know, Riley, I don't have an update for you today. I think our last number was 18, and I haven't received an update on that. I did not ask today, but I did check on Monday. And that's in Lancaster County, I remind you. What were the hospitalizations on the Eagles Club? We had 4 hospitalizations related to individuals from the Eagles Club.
This is Bill again. Sorry, go ahead, Jeff. I'll wait.
I have questions for the mayor, Bill. If you have questions for Director Lopez, go ahead.
Just a quick one. You mentioned, Pat, last week that we were kind of teetering on the edge of upper orange with that risk dial. I know there's no update right now and you take 3 weeks worth of data, but with LPS scheduled to go full slate, eliminating that 3-2 high school schedule in the second quarter. Are there ongoing discussions? Are you revisiting that with Lincoln Public Schools?
Actually, we meet with LPS once a week or even twice a week. And right now we're meeting with them going over some information. And I also want to share that we have a regularly scheduled meeting with all of the administrators, both in Lincoln and Lancaster County, on a weekly basis where we review all of this information and what's happening in the schools. So we'll be providing more updates on Friday.
I think Mr. Robb had a question.
Yes, Jeff Robb from the World Herald.
Hey, Jeff.
So the Lancaster County has the directed health measure. It's more than just the mask mandate. Is there any aspect of the DHM that you feel is working?
Well, all of it. We have those measures in place because we believe they are the best things we can be doing to protect individuals and businesses and be able to allow folks to move about our community with some reassurance that preventative practices are in place. You know, there is such a link between the measures and our economic recovery. So much of our economic recovery and renewal depends on consumer confidence. And when consumers know that they're going to walk into a store and employees are masked, and we want our businesses to succeed despite all of these challenges. So everything we do is a collaboration with our community, with our businesses, with our schools, with our nonprofits, with our healthcare system, and our residents, so that we can try to navigate this and maintain a thriving community despite these unprecedented challenges. We continually evaluate our measures and update as we see a need for them. But they're there for a reason.
Well, let's just ask about the size of gatherings, for instance. Do you know that those kinds of restrictions are helping? You're raising concerns about smaller events.
Smaller events where people are setting aside their masks, setting aside the distancing guidelines. It's not all about just the size. It's about the practices that are in place within the gathering. When we have a large community event, typically, if it meets a certain size threshold, they submit a plan to the health department, and our health team works with them to ensure that they know how to safely convene people. And we saw that happen with the LPS's graduations. We saw all of the practices in place, sitting students a decent distance apart, wiping down the handrails on the stage as graduates exited. They were practicing public health prevention measures at that graduation, and we had a successful gathering of a large number of people at Pinnacle Bank Arena. What we were talking about in recent case investigations, what's different about what we're seeing is that when people feel more comfortable, because they're just getting together with extended family outside their house, or people who they are familiar with, their close circle of friends, they feel more comfortable setting aside the mask or sitting a little closer. And the message we really want to get out to folks is, don't get too comfortable. We need to stay smart to stay safe. And staying smart involves wearing a mask, even around people you love and know and are familiar with. You're protecting them when you do that. We don't want to see more case investigations show that people are headed to the hospital because they got together with a group of friends, a small group of friends, but didn't utilize these common sense steps that help prevent the transmission of COVID-19.
So on the recommendations, you've had your standard recommendations: wear a mask, watch your distance, wash your hands. Mm-hmm. Is there anything more that the city, the county, the health department can do to spread that message or to get that across better? And public service announcements.
Mm-hmm. Yeah, we've been doing those, and we've worked with marketing agencies to try to reach targeted demographics like youth prior to college students coming back to our community and schools resuming. We did focused campaigns with targeting youth audiences, particularly those who feel invincible and maybe come from outside our community and aren't as familiar with the practices. We're undertaking another campaign as a result of the Economic Recovery Task Force recommendations to try to remind everyone that these practices, while absolutely critical to public health, are also absolutely critical to our economic recovery. And so when you wear a mask, when you keep your distance and you wash your hands, you're helping keep businesses open in our community. You're helping keep kids in our classrooms. So we are doing that kind of work. We do have PSAs. We've worked with our cultural centers as well to do PSAs in different languages to try to reach everyone in our community. If anyone has any other suggestions or ideas, we are open to them. We want to try to reach everyone as best we can. We're not going to reach everyone in a briefing like this, so we do utilize social media. We do utilize our community partners. We bring in experts. We're so grateful to have the partnership we have with our healthcare leaders because, these messages are coming when people go to the doctor's office too. We appreciate all of the work that everyone is doing to try to make sure people are informed, because information is power, and it's power to keep people safe.
And then I would ask a question of Mr. Woodridge.
Okay, thank you.
Thank you.
Yes.
Hi, this is Jeff Robb with the Omaha World Herald. So I think you answered this, but do you see a need for the state to regulate elective procedures as it did before through the directed health measures? And if not now, do you think there will come a time where that would be needed again?
I really don't see that as being directed by the state. I think as healthcare leaders, and we work with our medical staffs, we're able to build that into a plan. In fact, part of our plan is if we hit certain numbers, we will self-regulate our elective surgeries. So we're looking at the safety of individuals, and that's our number one goal. So I really feel that we have everybody's minds around the table. We're sharing this information with our health department so they know our approach to it, and there's a plan in place should those numbers reach those higher levels.
Are you getting close to those numbers?
Not at Bryan. I still think we have a little ways to go till we hit that level. So we're right now, like we've said, it's just stressful on staff at this point in time, and we're getting them that relief that they've needed for a period of time by bringing in some agency help and offering some incentives for other staff that may be part-time to work full-time. So we do have a little bit of grace here, but it's the message we're trying to give that if people do let their guard down, we're going to hit those numbers pretty quickly. So we have to stay diligent in what the mayor has shared with you and what Pat has shared. We've got to keep this in front of our public, educate them appropriately, and I believe we can get through this successfully.
And while you're up there, maybe you could answer this. I mean, it's tough to keep these mandates continually going. There's a lot of public pressure not to have these, but if we didn't have them, where do you think we would be?
I think if we didn't have these mandates, you would hear the same stories here locally that you were hearing in New York and California and Portland and all of those other places. So I give a lot of credit to the public officials here of regulating this to a manageable level for this community and for all of Nebraska. Otherwise, we could have easily gone to those same levels that you saw in other communities.
Mr. Woodridge, this is Bill with 1011. It seems like the hospital bed and ICU capacity has room for expansion and has remained fairly healthy so far. Is there more of a concern about those critical care workers, and if more patients come in, whether there would be sufficient staffing?
Yes, staffing is one of our key issues right now. That's why we're bringing in some agency help to assist in that scenario. We're also just looking at what are some of those functions that a nurse is performing that maybe a person of a different skill set could be providing to take some of that pressure, I would say, or that stress off of those healthcare workers. Thank you.
Are there any other questions from the media? Okay, well, we want to remind everyone that they can find more detailed information at our website, covid19.lincoln.ne.gov. We want to thank everyone for joining us today, and thank you for joining forces with all of those who are washing their hands, wearing masks, and watching their distance to protect friends, family, and neighbors from contracting COVID-19. Together, we are greater than this virus, and your care and concern will see us through. Thank you.